Okay, so who would be covered by the Affordable Care Act?
Everyone.
Everyone?
Everyone has the option to apply for it, as far as I can do.
Okay. According to HHS.gov, which is an insurance company as well, it says that, as you said, you're correct, anyone is possible for it, but it's more of those people that are underinsured and don't have the health coverage that other people that make more paying jobs for. As well, do you know, according to the Congressional Budget Office, which is CBO, what would be the cost of the Affordable Care Act?
Oh, it would be millions, billions of dollars.
You're correct again. An estimation that I found researching, which is something, they estimate between the periods of 2015 to 2014, it will be $1,487 billion. Okay, so according to the CBO, what effect will it have on the deficit reduction, if any at all?
I don't think it's going to reduce the deficit at all. It's going to increase it, because Congress is still not sure how they're going to be able to fund this insurance. They know everyone needs it, but they don't know all the details of how they're going to fund it. It's a new progress in work. New project.
Okay. According to CBO's actual website, it states that CBO estimates that under current law, the deficit will total $514 billion in fiscal year 2014, compared with $1.4 trillion in 2009. So they're estimating that the level would equal 3% of the national's economic output, or gross domestic product. As well, they average that it will additionally be seen in 40 years before it actually show a huge difference. So it's going to take a long time.
It is going to take a long time.
Do you know what insurance mandates are included in the Affordable Care Act?
I don't. I know they keep changing the cities to implement changes in the insurance industry for hospitals and doctors. We have had several changes with our insurance here, which is through WebKey, Blue Cross Blue Shield. But I'm not exactly familiar with all of the changes that are going on.
Okay. Something I found, you are correct, you said it was changing from city to city. As well, it kind of goes off the $60 per month kind of fine thing. If you don't pay it, then it will just increasingly get bigger. And they're saying that the penalty will be up to at least $3,000 per person in an average income. So that fine could be quite huge by not having it. Do you know what are the protections or the essential benefits of the Affordable Care Act?
It's supposed to benefit everyone that has not had an opportunity to have insurance. I know 4 people actually that have the Obamacare, and it has helped 3 significantly.
That's good. That shows a huge increase of something that could help our country. Something that I found interesting that is actually from, again, the CBO site, they say that no matter what, no one can be denied coverage for pre-existing conditions. Young adults stay on their parents' plan, which for someone that's out of high school or under the age is not a really bad thing, or someone under the age of 25, that's not too bad before you can finally get on your feet from college and different things. And then it also talks about prescription drugs. Do you know anything about that?
I don't know about the prescription drugs. I wish I did, because I would like to check into that myself. But I know that you can stay on the insurance, whether you're a student or you're living at home, whatever capacity you are, as long as you are a dependent of your parents until you are 26, which will really help a lot for the kids that are going to college or starting out, even in their business or just taking classes. And I would really like to learn more about the prescription, because that is a number one cost for the country. It's prescription drugs. There are so many people that have diabetes and high cholesterol and high blood pressure now because of the stress of the world. And so I think that it will help regulate that, get people healthier, and I think it'll really do a lot of good.
Right. Something that is actually found from it, they say that they must, or all insurance companies must sell prescription drug coverage because it is part of the 10 essential benefits of the Affordable Care Act. All health plans in the marketplace must include prescription drug coverage, but each state sets the limit of coverage per medicines, and also you may only have certain medicines on there, and they are categorized per state. So
all of our drug prescriptions are categorized now in any kind of insurance. You have 3 different tiers, and the different tiers cost different amounts. So that would be normal. That would fit in line with all insurance companies.
Yeah, so it wouldn't change a whole lot, is from my understanding of it, but they would still be there as well. Do you know any reforms to the Medicare that the Affordable Care Act created or included?
The reform were the no prior disease or problem or any health concerns that they had, past diseases or anything is covered. And so that is huge, especially for those people that have MS or their kids have autism or any of those diseases that families are struggling with and broke because they are paying for so much medical costs.
You're absolutely correct. If you look on health insurance, that's the actual one, it states that there shouldn't be any changes to it, but depending on your health-related issues or needs, then you will see either new benefits and cost savings, or you'll see a higher quality in your care to help you with that as well. Something that is really different out there is the employee part of it. Do you know what an employee's responsibility is under the Affordable Care Act?
I don't.
Okay, if you can, it's something people don't really research because it's new or something like that and people don't have time. But if you look on the IRS.gov, it states that as defined by the statute, a full-time employee is an individual employed for at least 30 hours, which is something that most people know. The employee must meet the 50 full-time employee threshold to refer as an applicant large employee. As well, it states that under the employee shared responsibility provisions, these employees do not offer affordable health coverage that provides the minimum levels of coverage to their full-time employees, and that employee may be subjected to an employee shared responsibility payment, meaning that if they're a full-time employee, then they'll have to share it with someone else as well. It also states that receives a premium tax credit for purchasing individual coverage on the one and new Affordable Care Act insurance, and you can find it at the marketplace as normal. If not, if the business or the ACA does not require the business to have health care, but the employees will actually face a penalty because the business does not have it, so it's fully recommended that the business does have it for their company because it cannot just affect them but their employees as well. Do you know what the effects are on small businesses?
Small businesses said they would probably just pay the penalty because the penalty would be cheaper than purchasing insurance for their employees. But I think that if it's affordable, it's supposed to be affordable, and I know it's based on your salary. So I think that if it was affordable, that the employees could support or the employer could support their employees to sign up for it and at least get some insurance.
Okay.
So there is an option out there now that has not been there before.
You're so very correct about the option there. Something that is interesting is Obamacare facts states that while 96% of the employees won't pay additional taxes, there's an increase to the current Medicare part, and they pay about 3% of the businesses. Employees make over $200,000, then they are required for the employees to be equivalent of the 50 full-time. So in the end, the employees and the work will most likely go out of business from paying the fine. So we're here to talk about the Affordable Care Act. Do you know what are or is affected on the small business by the Affordable Care Act?
Not for sure. I think that small businesses either have to provide some kind of insurance for their employees, or their employees have to sign up for it on their own, but I'm not sure how all that works.
Okay, going through and researching and developing, I kind of have one side that says that's by the whitehouse.gov, and it says that the Affordable Care Act isn't really working for small business because of the heavy taxing on them and their employees. And then also at the same time, it states that due to high broker fees, fixed administrative costs, and adverse selection, small businesses pay up to 18% more per worker than large firm for the small health insurance policy. So in the end, the small businesses are losing money. So that could kind of be a huge effect because they're kind of what boost our economy. Do you know how will the Affordable Care Act affect taxes we pay?
I don't know how for sure, but I feel like it'll probably cost most of us more tax dollars to be able to afford to pay for it. So I don't know.
Okay, according to the IRS.gov, it states that there are two main taxations. The first one is a net investment income tax, which went into effect January 1st of 2013. 3.8% of the net investment income tax applies to individuals, estates, and trusts that have certain investments income above certain threshold amounts, the 0.9% additional Medicare tax applies to individual wages. At the same time, you have the threshold amount are $250,000 for married taxpayers who file jointly, $125,000 for married taxpayers who file separately, and $200,000 for all other taxpayers. Also, the employees will be responsible for their own, which is called the additional Medicare tax from wages, and on average, they'll pay about $200,000 in a calendar year. So in the end, that's a lot of money, but hopefully it will show somehow, some way to our economy.
Hopefully, huh?
Do you know how the bill would be paid for?
I don't know that. I'm assuming through taxpayer, the taxes that we as citizens pay.
You're so very correct. It states, according to CNN, it states that they will come from new taxes, fees on industries involved in healthcare, and cuts in projected spending growth for the government health efforts just from the Medicare. So they're hoping that by the end, the long-term effect of it will help pay for the $940 billion bill. Something that's kind of a touchy subject, but do you know if abortions will be dealt with under the Affordable Care Act?
I do not know that. I'm assuming that it probably will be.
Actually, you're kind of close, but on that one, you're incorrect. The healthcare plan will not cover abortion, nor will the federal funds in any way for that possible, because unless it's for those who are in rape or incest, and the life of the woman could be in danger.
Okay, so I'm happy to know that.
There is actually new restrictions on that recently. Do you know what some of the major criticism of the legislation were because of the Affordable Care Act?
I think it was just because the bill was so long and cumbersome to read. There were so many pages to it that it was hard to understand, and I think a lot of them had some issues with that.
I completely, totally agree with you. Something else that kind of stood out was the number that they wanted to enroll on it. It was a huge number, and when it didn't come out, or when it came out and the number didn't hit right off like they thought it would, it had a huge criticism saying it wasn't working already, and so we kind of judged a little bit too early before we understood it. Do you know what those that are supporting the Affordable Care Act are stating as their justification for the creation?
I don't know for sure. I think maybe that just to make sure that everybody has a chance to be insured or has the ability to be insured, I guess.
You're completely correct. That is something that everyone is kind of going off of. Everyone should insure it. Some people, it affects goodly for them, and some others not so well. Mm-hmm. Do you know what the Republicans' base alternates to the Affordable Care Act were when they were trying to kind of rearrange it to help a little bit more?
I heard something about that, but I can't remember what it was, so I don't know.
According to New York Times, it states that Republicans are expanding tax-free health savings accounts to help individuals pay for private health insurance. As well, kind of the federal or state high-risk pools where people with pre-existing medical conditions could seek insurance with government assistance and allow small businesses to pull together to purchase health plans. So many of the bills were kind of trying to help people that couldn't still do it, and so it was just trying to make the bill just a little bit more better. Mm-hmm. And so it's actually still going through the government debate because the Democrats don't completely agree with it because they think the bill's perfect how it needs to be. Do you know who will be covered by the bill?
I'm assuming that anybody that signs up for it will be. I don't know.
You're correct, anyone that signs up for it. What the bill was kind of made out there for was to aim to those who were uninsured or people who had healthcare coverage that did not protect them from high medical expenses. Or someone under the age of 26 that was in college and having issues paying it because they were paying college fees and different things like that because they weren't getting grants. And so it was kind of for just not only that, but no one was allowed to, through this new bill, no one's allowed to be denied or limits from the benefits. And then the prescription drugs of it can also help those families who need it and are struggling. According to the Congressional Budget Office, or CBO, what will be the cost of the Affordable Care Act? Do you know?
I do not know. I think a lot.
Actually, you are correct. According to the HHS.gov, it states that between the years of 2015 and 2014, their estimate will be over $1 trillion.
Oh.
And so it's kind of a high span, but they're hoping in a 10-year period, that at least $9 billion of the net cost will be coming up from it. So $9 billion of it will be in return, so it won't look as bad. Also, do you know if the healthcare will affect the deficit, if any way?
I don't know. I don't think it'll help the deficit. I think it might make it worse.
That happens. It really does. According to a couple different posts, Washington Post states that more than 2 million Americans who would otherwise rely on a job for health insurance will quit working, reduce their hours, or stop looking for employment because of the new health care benefits. And then at the same time, Huffington Post states that the opponents of the Affordable Care Act have used the most recent Congressional Budget Office report on the nation's economy to claim that the health care law is actually killing jobs and forcing people out of the labor market. Mm-hmm. But if you actually want to go to the CBO website, so there's kind of different posts within the actual website, the CBO states that under current law, the deficit will total $514 billion in the fiscal year 2014, compared to the $1.4 trillion in 2009. So they're hoping it will go down quite largely. Mm-hmm. And then I have one last question for you.
Okay.
Do you know what insurance mandates are included in the Affordable Care Act?
No.
Okay. At least you're being honest. It actually depends on the state, the city, different kind of things like that.
Mhm.
I know in Utah they're the third highest state employee plan compared to Wyoming, which is going off the federal default, which is small group plans. The mandate works as a conditional tax. By 2016, when the tax is fully phased in, individuals who do not purchase insurance coverage will pay about $60 per month, and then the fee will will go up each and every year. And they're estimating if you still don't continue to pay it and have the penalty, then the penalty can raise to at least $3,000.
Wow.
Yes, so it's a huge penalty.
Yeah.
Kat, do you know what the protections or the essential benefits of the Affordable Care Act are?
No.
No. Okay. According to Obamacare Facts, which is kind of if you go to the marketplace and then it kind of gives you these things to help you, it states that new health insurance allows shoppers to compare health plans that include all new benefits, rights, and protections, cost assistance to individuals, families, and small businesses through the market. There will be no annual or lifetime limits on health care. Insurance companies can't drop you when you are sick or for making a mistake on your application, which is pretty important. And you can't be denied coverage for pre-existing conditions, such as young adults under the age of 26, and prescription drugs, hospitalization, maternal and newborn care, or grandfather plans that's not out of the pocket limit. So kind of the new ones. Also, what reforms to Medicare did the Affordable Care Act create or include? Do you know?
No, I don't.
Okay. According to Medicare, it states that to have to replace your Medicare coverage, you actually really don't have to. As well, you'll see the new benefits and cost savings for those who have health-related needs, according to the Act. Do you know what effects it has on the prescription drugs at all?
Nope. No.
That's a good thing, because that means we're teaching you something.
Yeah. Well, and I told you, what I know about affordable health care is that we don't need it because our plan meets all the guidelines. So we have a good plan, and we don't qualify for affordable health care. So.
And see, it just depends on the company or your insurance and different things like that. So in a way, that's good. For prescription drugs, all of them have to coverage it because it's part of the 10 essential benefits of the Affordable Care Act. So no matter where you go, no matter what it is, all insurance plans must cover it. Do you know about the employee responsibility under the Affordable Care Act?
Which part? Like, what do you mean?
Okay, kind of what I'm asking is more about the employees, like large companies, small companies, anything like that.
The parts about whether your plan is approved, or
kind of what you were talking about earlier when you were saying that you guys don't need it because you guys are a larger company.
I can't remember exactly, but there's a percentage of what you charge and all that. Yeah, I have those things at my disposal, but I don't know them off the top of my head.
Yeah. And see, that's not a bad thing. So you know a little bit about it. Mostly what it is that people that if the company doesn't buy the insurance for the employees, then the Affordable Care Act doesn't require the business to, but the employees will have to face the penalties, and so they must have they should cover themselves.
Right.
So if the company doesn't, then the employees have to find a way to do it. Do you know what any of the major criticism of the legislature was for creating this bill?
How far back are you going with the?
It's whatever you know.
Yeah. Let's go with no. I'm gonna go with no. I'll let you tell me.
Okay. The number of people enrolling in it. when people didn't enroll in it right away and were kind of iffy about it, and there still are people iffy about it, and the numbers weren't hit, then people immediately started criticizing, saying this isn't going to work, you need to get rid of it, can't believe you did this, and different things like that. And so that was just one of the major criticism, as well the money of it, how much it's going to cost our country, how much it's going to put us more in debt, if it will ever help us get out of debt. And so those were just some of the main ones. Do you know what those that support the Affordable Care Act state for it? Like the justification of the creation, is it good, bad, what they think of it? Do you know anything?
Oh, just guessing, just to have, everyone covered.
Mm-hmm.
And when that's good, if you have health insurance and can get the medical care that you need. So, I don't know what else beyond that.
You're actually correct. You're on that. Do you know how the bill would be paid for?
Taxes?
Yes, very much so. A lot of taxes. Yep, your money. It's just something, I guess, that our country likes to do is taxes. This might be an issue. I don't know what you think about abortions, but do you know about or how abortions are dealt with under the Affordable Care Act at all?
No.
Okay, under the Affordable Care Act, the federal government will not fund anything unless it is a case of rape, incest, or if the life of a woman would be in danger. So it's kind of like the new restrictions that's already started coming out before the bill. It's just a little bit more controlling now, I guess you could say. I have one last question for you.
Okay.
Do you know how the small businesses are affected by it?
Well, let's see. So if you don't have a plan, then they go sign up on the marketplace. Do they have to pay something? I don't know for sure, but they have to pay something. Don't they?
Yeah, everyone has to pay something, of course. According to whitehouse.gov, it states that people with the cost and different things like that are paying up to 18% more than in large firms. But if you look at Obamacare facts, it's stating that while 96% of the employees won't pay additional taxes, there's still an increase to the Medicare part. So they pay about 3% of the businesses, and then the employees making over $200,000 will pay for the rest of it. So it's kind of depending on the employees, but the small businesses are actually affected quite largely through this because they're paying a lot more than large businesses. Because with a large business, you get a better coverage, I guess you could say, like it's cheaper,
Right.
and small businesses have to pay a lot more than a large company. So,
Okay.
but thank you.
You're welcome.